Welcome to Health Reform 2.0, the only place on the internet for people with a curious mind and a desire for a better healthcare system. Here we take you on a journey of our current quagmire, tell you where it came from and why the government can't fix it. Along the way, we'll tell you some history, bust a few big myths, tell you a few stories, and give you an idea how we can work together and get the healthcare system we want. Let's get started. Welcome again, ladies and gentlemen, to Health Reform 2.0. I'm your host, Tom Locher. I'm joined again by my partner in crime, Tim Henning, and today we're going to talk to you about why healthcare is so damn dangerous. So without further ado, I'm going to turn it over to Tim, and he'll set the stage.
Thanks, Tom. You know, one of the themes for season 2 has been dangerous, hostile, and predatory. We've covered on the predatory side before. We'll be doing the hostile piece next. So we thought we'd talk about the danger of seeking healthcare. And we have mentioned this before. We've given you some statistics in the previous episode, but we're going to dive a little bit more into it. And we have some data, some charts that you might find interesting. Now, we're not here to scare anybody. Modern medicine does some wonderful and great things. You know, did for you. Fortunately, I've not had anything really bad go wrong, but a lot of people have. Now, if you've been on the provider side, you know what you see on a daily basis, and it's something that the normal person does not see. So we're going to focus on the dangers of seeking healthcare and give you some facts and figures that will hopefully make you aware of some of the mistakes, infections, wrong diagnosis, malfunctioning equipment, your point, which I deal with every day. Electronic medical records, well, I got to really go off on this one with what they're doing now with this. Do you hear about this thing with the same thing they use for Bitcoin? It's called blockchain. We'll talk about that.
Yeah, that is a blockchain.
We're moving from the salvation of the world to the EMR to the salvation now of blockchain.
Yeah, somebody called me yesterday, Tim, talked to me about blockchain, wanted to know what I thought of it. And I said, look at the price of the Bitcoin. Yeah. Right? Look at the price of the Bitcoin. Blockchain hadn't done a damn thing for Bitcoin. And the other problem with the concept of blockchain is there's almost no one really understands what it is. It's little more than an architectural technique. And if you talk to good system architects, people that really know this, they'll tell you blockchain is not the right way to go for 99% of the things we want to use.
Yeah, but by gosh, it's going to fix healthcare. I just can't wait for this one.
Oh, it's going to be the cure. It's going to be the next Lipitor. It's going to absolutely cure heart disease. Yep. And we all know how well that worked.
Yeah. Yep. HIMSS is going on right now down in Florida, the information hospital systems thing, and you know, and the stuff coming out of there. Last year was a big hype. This year, I haven't heard anything.
Well, technology hadn't had a real good play in the last 3 or 4 years. No. EMR is one of the major players in increasing the risk of care.
So again, modern healthcare treatments and advanced technology do wonderful things, especially when it comes to trauma, cardiac, orthopedics, things that we can actually get in and fix. But there's also dangers associated with that, and we're going to give you some examples. The hope is to give you and your facilitator, your advocate, some insight into where some of the landmines are in receiving healthcare, so you can be more aware.
And that's not to mention that healthcare is the riskiest single thing you can do in your life is to seek healthcare. And the statistics and the data points all prove that.
So there should be a chart up there. They do some comparisons between healthcare and some of the more dangerous jobs. We have one ideal system to dangerous systems. Hospitals right down there on the left-hand side of dangerous systems with motorcycle racing, extreme mountain climbing, and bungee jumping. Probably a few others in there too. So the fact, 1 in 4 U.S. hospital patients suffer at least one healthcare-related injury. That's a lot. 1999 data estimated between 44,000 and 98,000 patients die in U.S. hospitals each year due to medical errors and other hazards. The 2013 data, next chart, it's about 251,000 and growing. We're going to go over that in a few minutes as well, because it's exponentially gone up between then and now. So, Tom, we've talked about this before in our previous episodes. What are some of the most dangerous, professions, jobs out there?
Well, some of the most dangerous jobs are firefighter. Mm-hmm. That's a dangerous job. Race car drivers, relatively dangerous. A number of other occupations, soldiers have a very dangerous job. Right. There are a number of occupations out there. And the firefighter is second to the highest, believe it or not. And 100 firefighters die out of 100,000 every year.
Yeah.
And you think, wow, that's a lot of firefighters. Well, then you have commercial fishermen, mm-hmm. and 263 commercial fishermen die out of 100,000. It's twice as dangerous to be out on a crab boat or a tuna boat in the open ocean as it is to be a fireman running in and out of burning buildings that can explode and have all kinds of problems. But what's more dangerous than that is healthcare. And we've shown this a couple of times, and the chart's on the screen again now. But for healthcare in 1999, 263 people out of 100,000 died. So it was more than firefighters. Now, after 2013 study by the same Institute of Medicine, did the first study, did the second study, we're well over 400 people out of 100,000 dying every year as a result of seeking health care. Now, that includes problems in medication, that includes surgical problems, that includes hospital-acquired infections, that includes a number of other related issues that can happen. That's a culmination of all of those numbers you just looked at. Right. But it is a huge and highly dangerous thing to go off and get care. I mean, there were 3 different points in my first few days in the hospital that I could have died because of either equipment malfunctions,
number 1,
system malfunctions, or other malfunctions that I won't go into at this point.
The EMR putting your wrong medication up on the screen.
Exactly.
Exactly. That could have definitely killed you if it hadn't been human intervention.
Right.
Thank God you had the same nurse there the next day.
Yeah. So it's getting healthcare is dangerous. It's one of the worst. I was at a cardiac rehab thing yesterday, and we were talking about a number of topics, and one of these came up, and the nurse that was up there, she goes, one of the most dangerous places you're going to go is a hospital. And it's true.
I better get the hell out.
And it's not the fault of the hospital. It's just the way it is.
That's the way it is. Today, this comes from Maggie Marr's book. Now, Maggie's book is 4 or 5 years old, right, and it's still relevant, but the data is a little bit different now. And this was 4 or 5 years ago. Today, the mistakes in the use of medical technology accounts for about 400,000 deaths per year. We mentioned that before in the United States. But we don't have any way of doing comparative information and data and synthesizing that data. There's no one assigned to that.
Right.
There's some legislation pending, but again, don't look over here. We don't want you to know this.
Well, they produce mortality and morbidity statistics, and they did for years, but you go try to find them today, and they're impossible to find.
And
impossible.
They can have the morbidity, but they don't break it down as to why.
Right.
Here's another one. This is one that I wish did not happen. It still happens. More than it should. It's improved since I was involved in healthcare many, many years ago from a provider side. This is from Dr. Martin Macri. He's a surgical oncologist and chief at Johns Hopkins Transplant Center. Definitely a heavyweight. Mm-hmm. Quote, too often the healthcare system silences people around the problem. Ladies and gentlemen, that is a fact. You hear stories, and fortunately sometimes now it's being more exposed. How many times does a surgeon show up for surgery drunk or been drinking? Mm-hmm. How many times have I been in a radiologist's office where you can't even breathe because the smell of marijuana that he's smoking while he's reading your image is amazing. You can't make this stuff
And he's
up.
got a prescription.
He's got one. I'm fine with him. I don't want him reading my scan.
Right.
In that situation.
Right.
There's more. If if you take a look recently, I think this happened here in the Bay Area where they finally arrested a guy. Somebody finally blew the whistle. But it was an interesting study. I know it was 60 Minutes or one of those type of magazines. So what they did, there was a medical center, I'm not sure where it was, and they either had the actual physicians and nurses go over to a restaurant next to, I don't know if you remember seeing this, next to the hospital during the day for lunch. They could have been actors or they could have been real doctors, but they had the lab coats on with Dr. So-and-so.
Right.
So they're sitting around the table, they're having lunch, and they're drinking like 4 or 5 martinis. And people are looking over watching these guys, and they're talking about, hey, we got to go back and do this surgery, do this and this, and they have another drink. Well, it's not really alcohol, it's water, it's all staged.
Right.
Do you know how many people actually called and intervened in that?
I would bet none.
None.
Not a one. Not a one.
Not a one.
You know, the best eyes, if you want to find out about a good doctor in a hospital, ask a nurse.
Ask a nurse.
Ask a nurse.
Because they all know who they are.
They do, but they can't talk about it.
They all know who they are. They have their own little system of, I got to close my eyes over here because I know it's going to go, but don't ever let that guy touch my loved one or whatever. They all know it, every one of them.
You've been listening to Health Reform 2.0 with your hosts Tom Locher and Tim Henning. We hope you found the topics interesting, that we answered a few questions, that you laughed a bit and were entertained. Please feel free to invite your friends to join the discussion, and remember, hit that like button and don't forget to subscribe. Send us your questions to info@hr-20.com. We hope to see you again next time.